I had a different experience this year in Health and Human Services, and I'd like to talk about diligence. My colleague from Anoka mentioned diligence. We knew we had the challenge of our generation. What we do this session is history making for our generation. We knew that going in. We knew it was going to be important to protect the vulnerable, our institutions, and our future. And from the start of the session, I joined with my colleagues and met with the different stakeholders and constituencies, providers, the CEOs of hospitals, to talk about how can we balance this budget and protect these fundamental institutions. And we set forth on a very difficult and intentional process to build a budget that some have called masterful, that I think is balanced, that cuts deeply in hospitals, nursing facilities, the disabled, providers. Everyone's taking a cut, but they're taking a cut in a way that they can sustain themselves through this recession so that people can get health care throughout the state of Minnesota. I've learned so much this session. I've learned that we can do a hard job together. And I've learned that we can make difficult decisions for the future of Minnesota. But there's a limit to what we can accomplish. I had some difficulty with the department this year. We had a lot of good ideas, and we never got a fiscal note for them. A lot of good cut ideas. Fiscal notes came late to us. It was hard to get good information about how to do our work. When the governor sent us his supplemental budget on March 17th, he had a rudimentary proposal for reform of general assistance medical care, which is basic health care for the poorest of the poor, the sickest of the sick in Minnesota. It was a single page. It talked a little bit about care coordination. It eliminated inpatient hospitalization and created a pool. I was intrigued by that. The hospital said we didn't think it was going to work because it was too deep a cut to the hospitals, but I was intrigued. And I called the assistant commissioner, and I met with them. What do you mean by this? What are you looking for? Well, we really don't know. We haven't really fleshed it out. That's what I got in return. I met with advocates. They were worried. What does that mean if we end the entitlement or if we end hospitalization for these people? What is that going to mean for them? And I met with the advocates, and we met with people from the Department of Human Services, and still no proposal. On April 8th, I had the email with me. Advocates met with the Department of Human Services and people from the nonprofit community. What is the proposal from the department on GAMC? They don't have language yet. They don't have a proposal. I think there's reform to be had based on the work that we did last year, but there's a limit to what we can accomplish. And this vulnerable population deserves our utmost attention as we plan for how we're going to deliver care for these people, to get them the best care, to get them stable housing. I'm not willing to do that in 2 days, and with all due respect to Mike Comfrey, Representative Abler, and we work together very well, 14 days together in the conference committee, there are few soft landings left. There are few soft landings left in Health and Human Services. And the cuts to be made through an allotment are going to be very difficult. I was shocked when we got this veto. This is the most vulnerable population. I cared for them as a nurse.